Guide catheter extensions are a fundamental part of what we do every day in the cath lab. There have been a few things that have all happened in tandem. We've had an aging population, aging demographic. We've had the development of drug-eluting stents, and that means that we can treat longer segments of disease with high efficacy and good longer-term results. But the combination of calcium and tortuosity in the coronary mean that getting these stents to those segments or through those segments is actually very, very challenging. And those are the biggest rate limiting steps that we face in our day-to-day practice. What that means, if you have guide catheter extensions and you use them regularly, that you will make your procedures safer and more efficient, and you'll get a better outcome for your patients. So I think not having them is potentially catastrophic as to where we are in daily practice. There are several important aspects of the devices and they need to be broken down. Anything we do in a cath lab, safety is always the paramount consideration. So when you're introducing any device into the coronary, you want to make sure that it's not going to injure healthy parts of the vessel. So there are features such as the device being appropriately flexible, kink resistant, and you don't want to put something very stiff into the artery that would create a dissection, for example, in a healthy proximal area.
The tip of the Guidion shows that safety is key to IMDS products. Unlike the competition, Guidion doesn't have a rigid marker band present in the tip, and there's also no need to because the tip is created from fully radiopaque material. So because of that, Guidion is the only guide extension catheter that has a true visible distal tip. So it's making it fully soft and very beneficial for precise stent placement. The latest version of the Guidion has a flex zone in the distal part, and this part is more flexible compared to the rest of the shaft, allowing it to cross the coronaries even in the presence of tortuosity without kinking at very short ends.
A second feature of the devices then is deliverability. So you've got to be able to actually get them deeply into the coronary circulation without causing problems, but also to maintain their efficacy to be able to deliver the secondary pieces of equipment.
The deliverability is also improved by this more flexible distal section. And besides that, the proximal shaft of the Guidion is oval. We only increased it in the long axis to increase the pushability. In the short axis, the diameter is kept as small as possible to allow drug-coated stents to pass along the proximal shaft of the device. So this combination of the high pushable proximal shaft, the flex zone in the distal section, and also the hydrophilic coating, this is resulting in outstanding performance of the Guidion. To ensure that secondary devices pass friction-free into the target area of the coronary, the transition from proximal to distal shaft, together with the size of the proximal shaft, are very important.
So another important safety feature of the device is, certainly historically when they first came into practice, we saw a lot of interaction between stents being passed through the transition zone or the proximal collar that could be damaged, deformed, or even stripped off. And I think that it's very important that that is not something that we have to deal with in modern practice.
The metal push rod of the Guidion is fully embedded in the polymer distal shaft.
So the final aspect is the overall functionality of the device. Not only that it itself can be delivered deeply into the coronary circulation, but also that you can get large caliber and long stents through the entire length of the body of it. There are design features which enhance and facilitate the free crossing of stents distally as well as proximally.
Different than some of the competitors, we took into account the space that allows a maximum diameter of stents to be passed through the distal shaft. So we don't have a negative free crossing space, meaning that devices can be passed through the distal shaft, also can pass without any interference of the metal along the proximal shaft. With the oval shaft design of Guidion, we can have an optimal balance between the high pushability plus enough space for drug-eluting stents to be delivered on target safely.
These devices promote treating complex lesions in a safe and an efficient way. And overall, all that can do is sort of reduce contrast load, radiation, make the physicians more comfortable and their job more straightforward. I don't think there is any barrier to the use of these devices. They've been around for a long time. The question in physicians' minds should be, why would you not use one rather than why should you use one? And I think they definitely improve our practice and make the job easier and safer.